Hi, and welcome to a special episode of our Experiencing Consciousness podcast. We are
Roxanna Erickson,
Kathryn Rossi,
and I'm Dyba.
We are so happy you are here. From Zakopane, Poland, I present you Dyba. I present you Roxanna Erickson-Klein.
And I present you Dr. Kathryn Rossi and Dr. Roxanna Erickson-Klein. And yes, we are here today with another episode of our podcast, podcasting to you directly from Zakopane and from
Dallas, Texas.
Exactly. Joint venture and joint adventure. Okay, so Dr. Erickson-Klein, you proposed that we're gonna be talking about doing hypnosis, about what's your stand on doing hypnosis with family and friends. That's a great topic, but it comes up with a question that I have for you. I was actually discussing it, I think, a few days ago with Dr. Rossi. I didn't know if it wasn't too bold to ask you that question, but
since you're asking it, then exactly. I guess we could go forward.
Just let's go with it. I mean, I read a lot of case studies and also papers from Dr. Milton H. Erickson, and so many times he mentions you or other children that he had, and that either he creates an example out of you, that there was some kind of knee operation or some kind of accident, and he did something to either you or Alan, for example, and then also there are descriptions of how he was involving you and other members of his family in therapies of various people. So I was thinking to ask you, because I never had such an experience in my life. So I was thinking how it is to be a child and is it actually true, and to what degree, and how it is to be a child in a home where, you're actively participating in something like that. What were your impressions, and how was it, to read about yourself in those papers, and also, all the other things that can come up to your head connected with this area.
Okay. So I want to start by saying that this is one of the most frequently asked questions that people come to me about. They say, "Oh, I read your name. Are you the one that did this and that?" And sometimes it's me, sometimes it's one of my siblings. And it always surprises me that my name is familiar to these people who read a book. And to be totally honest, I didn't read my dad's writings, and neither did my siblings. We were not drawn to read what seemed like boring scholastic stuff, when it was so much easier just to have a conversation. What do you think about this? Or what do you think about that? Or let me tell you what happened today. So we didn't, none of my siblings read Dad's works until we were an adult professionals. That's when we thought, gotta pick this up and read it. I will say that there was 2 books, Uncommon Therapy and My Voice Will Go With You, that were written in a much more readable narrative form, that we read those. But in terms of the serious works, that just didn't appeal to us for reading. But it was true. The dad, even way before I was born, when he first started learning about hypnosis, he went home and practiced on his sisters. And my aunts would tell me of how he practiced. He one of them had dental problems, and this is a good opportunity for me to practice hypnosis before you get your dental work done. So he was doing that with his sisters way before he had his professional education. But once he was educated professionally and started to get more rigid in his thinking that hypnosis belongs in the hand of medical professionals, he became more rigid of he was qualified to do hypnosis, and he was qualified to teach us hypnosis that we could then use for our own use, but we were not to use it on our friends or on each other, anything like that.
Unlike what he did. I'm just saying, you know.
So in my family, as kids, were used really very extensively for his explorations and for demonstration to his patients. But all of us were pretty timid about using hypnosis, even when we had the professional training. We didn't use it on our kids or on our each other, certainly not on our friends. So we kind of drew the line there. And then when I got to be friends with Kathryn, I realized that you and Ernie had almost like an exchange where you were kind of equals in your exchange, whereas so it was different. It was different in that I feel like you not only had a qualitatively different experience, but then you mentioned to me, oh, your niece needed some attention, and you were able to do this hypnotic intervention. With me, I still have hesitation.
It's great. You know, I mean, because that it's true that if I had a problem and I was mystified by the problem, and Ernie would ask me if I would like to have a hypnotic experience, and I almost always said yes. And of course, I'd seen him do so many individual demonstrations, so I knew how it went. I knew that it was going to be private. I could speak or not speak, and I could tell him my experience or keep it to myself. And so very easily I would be part of that. And then when I would see if Ernie was in a situation where maybe a hypnotic intervention would be good for him, I would ask him if he wanted that. And most of the time he said yes. And so it was just a different way that we were with each other. And so it's kind of interesting. Quite frankly, I think that your father was wise with you kids to say, you know, that it's not going to be a free-for-all.
Right.
That we're gonna, in the family, there's that he's the one that is the professional. And I can only imagine what would have happened in school for you if you would have been doing this with your friends.
It happened anyway.
Well, but then it would be, you know, there would be this discussion about parenting styles, and was your father any, you know, good as a parent, or that sort of thing. And so I think that was a protective mechanism so that you could have a private life separate from him.
So one of the things that Dad did is that he, as you read in his works, he would opportunistically, oh, somebody is injured, or somebody has a dental appointment, or somebody has a headache or a cut or something like that. Oh, this is an opportunity where hypnosis is called for. And so he would jump in without any formalities of this is how this sort of an the situation is handled, a crisis is handled with the hypnotic skills that are available, and to benefit the client, the subject, or the kid, or whoever it was. So we would dive in immediately if there was a need. But if he was experimenting with time distortion, or if he was, if we would express something, curiosity about positive hallucinations or negative hallucinations or color distortions or things like that, he would very graciously and very formally, would you like to practice hypnosis to discover a little bit deeper? So he would formalize the invitation, and then it was up to us to say, oh yes, I'm interested in doing that. So there was that agreement before there was any formal or in-depth trance work in that way.
So he let you choose. I mean, that he gave you choice. And I think that this is what's really important if you're going to work with family or friends, is that, and not everyone is going to do it, but you give them choice. It's not, so in that respect, it is respectful.
Mm-hmm. Mm-hmm. And so when one of the things before he would use us in his office or in a teaching seminar, before he would use us, he would privately ask, I am going to need a subject I have a patient coming in, and I would like to invite you to demonstrate what it is to go into hypnosis. Okay, he started this at a very early age. I was like 10 years old, but what preceded that was my sister-in-law had babies, natural childbirth using hypnosis. They lived in Phoenix, and she talked fairly extensively. Dad taught her how to go into a trance. Then she had the natural childbirth in her home. Then she relayed, her and my brother relayed to my younger sister and I what that using hypnosis for childbirth and what a wonderful experience it was. And then subsequently, I went to Dad and say, I want to learn more hypnosis. And he was very specific. Why do you want to learn? And I told him because, Lillian had the natural childbirth and it sounded great. And I know I'm going to be having babies someday, and I want to be prepared. I'm always one of these early prepared.
Yeah, I'd say that was a tad early at the age of 10, but nonetheless, you were curious.
Right. But it's characteristic of me. I always, as soon as I want to do something, I start doing the preparation work. But so he asked me in a very formal, dignified way, are you sure you want to do this? Not that many women feel like they want natural childbirth, and it isn't what they usually offer in the hospitals. And at that time, they weren't doing spinals, they were doing ether. And so at that time, I would say, well, what are the alternatives? And I knew about ether from reading, and I had my tonsils out and stuff. But, and it's like, no, I don't want to do that. I want hypnosis. And the reason why I wanted hypnosis and I was so fixated on it is because Lillian was so wide aware. She was so awake. and so aware that she was able to describe every step of the birth process and the joy of, of completing the birth with a healthy baby, and then, and truthfully, my brother then went over the afterbirth and the placenta and even he saved it and showed it to me.
So kind.
Was horrified to look at it. It was all bloody. I was horrified to look at it, but it was a good education, and I was able to express, yes, that is what I want. I want to be fully aware, fully engaged, fully participatory in the middle of everything. That's me. I want that experience. And so I was able to relay that back to my dad. And dad says, okay, well, I can give you a lot of training in the context of when a patient comes into my office. I'll ask you if you're available, if you'd like to demonstrate. If you're available, you can come in and then demonstrate. And so very, very routinely and regularly, he would get a patient in his office, and then he'd, call out the door, Roxy, will you come in here for a minute? And then he'd introduce, this is my child, my 10 or 12-year-old, 13-year-old child. And I would like my child to demonstrate a hypnotic induction just so the patient can get a better understanding of what the hypnosis is all about.
So the whole time it's respectful. I mean, that's because we've talked many times about many things, but not this in this detail. So it was this choice, this respect, and in this way, when you think of formalities, I think of formalities as being polite. And when you're polite, you're giving regard to all parties.
Right.
What do you think about Jan?
I think you still want to add something to that.
Okay. So what he did was he would opportunistically, I don't know why he thought that I was a good example for some patients and not for others, but there was a whole, and sometimes I tried to figure it out. Why did he call me in for this patient? Because since the waiting room was our living room, there was some familiarity with the patients, either they would chat with us as kids or they wouldn't. And that it wasn't necessarily the ones that were chatting to us that he wanted us to demonstrate. It was something about their therapeutic needs that that he would make a decision. This patient will benefit from seeing a child. It'll take away their anxiety or their fear. And sometimes he would have me demonstrate an induction. Usually a hand levitation was what he started with. He started with hand levitation. I can stand for hours with my hand elevated, hours and hours, indefinitely. Okay, so he would do this hand levitation induction, and sometimes he would then transition. Roxy, you just continue to stay there in your trance. You don't need to listen to anything that's being said. I'm not talking to you now. And then he'd talk to the patient and leave me propped in position for the whole duration of the trance, which I would have total amnesia for. I have no, no awareness of what was being discussed whatsoever. And other times I would do the demonstration, then he'd have me leave. And then he, after a while, and I'm talking about maybe a year or two, he kind of shifted gears and he was practicing confusion. And he started using confusion with me as that's what he was going to demonstrate. I don't know why he shifted gears. And at one point, I told him I didn't like the confusion induction. And he used it anyway, which made me even more confused. But it was effective, and it was, subsequent. So after the experience, he would, debrief to a degree. Is there anything you want different? Is there anything that was a problem for you? I mean, it never was. But then later, when he started having a lot of teaching seminars in the house, sometimes his students will say, I want to see automatic writing or whatever. And so he would call me in, do you want to do automatic writing? And I'm like, whatever. I'm game, whatever. And I remember picking up the pencil and nothing came. And then I remember hearing him explaining to the class, this isn't right for her, and we're going to go on. And he excused me and then went on to the students that were in the group. One of the students I got to know later, and I asked her what happened after that, and she said he picked up somebody else from the group and they had them demonstrate.
Isn't that, but how beautiful is this, is instead of him thinking, oh, I'm a failure, but just to say, well, this isn't right for her.
Right. Well,
and this kind of gentleness. There's one other thing that you said, when I think it was with the hand levitation, and he was actually priming you for amnesia. And when he said, and you don't have to listen to any of this now. And it seemed like he would use the word now in very, very clever ways. Anyway, that's a little bit of an aside, but it's just something that I noticed. But oh gosh, Roxy, this sounds fabulous.
Well, so the bottom line is I ended up with a real wealth of an education, just very extensive, very, as good of education probably as anybody in the world as, today has had. And it was interesting and it was fun. And it was exploratory because that's my personality. I'm an explorer. I like to try new things. I like to, even when I walk around the block, I'm looking to see what I missed last time and if I can get through somebody's backyard. I mean, that's me. That's my personality. But then when it came, as I said, he was so rigid that we are not to be doing this with our friends. And I didn't, even though I had a tremendous education, I didn't feel like it was really right to foist it on my kids. And so I kind of took the position that I'm going to wait until they show interest, okay? But on the other hand, you have somebody that's in, that's in an injury. I know that I'm responding with my hypnotic skills. They may not know, but I know. And of my kids, well, then I did another thing that I consider very clever and indirect, is that I hosted the North Texas Society of Clinical Hypnosis in our home. And I arranged for the kids to bake cookies and serve the cookies to the group and sit quietly in the group so that they could be attentive, so that they would draw in the information indirectly and learn about hypnosis. And then additionally, I offered, I always offered if they ever want to sit in on any of my teachings, they can do so. And if they wanted to, if they wanted to take a formal series of class, I would arrange it with another teacher, which I did with a couple of my kids. And truthfully, only one came to me and said Ethan said he wanted sport, he was a diver, competitive diver. And he wanted me to use hypnosis to help him focus, on doing a performance. And so I said, okay, I would do a formal trance induction, working with him. And he wanted to lay in the hammock, which was great. So I was in the hammock. And I started to work with him. And smack in the middle of the induction, I think somebody started jackhammering in the alley, and it was this tremendous racket that was interrupting. And Dad always had the attitude, you just, whatever's going on, you just forge. And so I just forged ahead, but I was very uncomfortable, sweating, feeling unsafe. And then at the conclusion, I did ask him, which is not my normal style, but I did ask him how everything went. And he said it was great. It was really wonderful. It really helped him. And finally I said, there was a little bit of a noisy disturbance. Did you hear that? And he said, oh, you mean when everyone was clapping at the good doctor?
That's right. That's what
That's
happened. That's right.
But I have been, reticent to reach out to my kids. I have one daughter who has a child. My other two daughters doesn't. Haley didn't want me to work with her with hypnosis. So she said, nope, I'm having a spinal. And I'm like, okay.
That choice.
So, right.
Yeah. I mean, but that's the theme that goes through everything you're talking about, is that there was always a choice. And, and that kind of respect, and that, and going with what the interests are.
Right.
So it wasn't like, because I think from the outside looking, there was always the question of, gee, did he use you guys? But you're saying
it was mutual. It was for mutual benefit.
I mean, yes, but by what I mean by using, it's like where someone is using, but there isn't enough in return. And but it was a mutual decision.
But one additional thing I want to say is that and I feel a little bit bad that I'm monopolizing all of those, but one thing I want to say is that my mother, Betty Alice, and myself, and my sister-in-law, Lillian, were the ones that Dad and my Aunt Bertha are the ones that my dad used as demonstration subjects. The other kids, my younger sister, my brother, not interested. They did not want to do that. But despite the fact that I got this, this bonus of education, it has come to my attention when I speak to my brother or my sister. How do you, they know a lot about hypnosis. They know how to use it. They soaked it in by osmosis. Just because they didn't have the same formal opportunities that I had, they had really substantial education. So I just wanted to comment
Yeah,
on that.
and I think that it's wonderful, because when you're in an environment where these things are happening, you can't help but pick it up.
Right.
Yeah.
I'm curious with you, Jan, because coming from a different environment, that you came from a setting where it would have been normal to practice on your friends and to explore, recklessly.
That's how you started.
I'm curious about this.
Well, first of all, I think no one at my home was actually practicing hypnosis. So no one told me to not do it on my friends or anyone. And no one actually knew at the beginning that I'm doing something like that. I started doing it when I was 13 because I watched a television show with a hypnotist, and I was just curious to explore it and fascinated with the whole thing. And then I was doing it on my friends, and we were doing crazy things like someone would do for example, positive hallucination, and I was like, it was only a matter of how and when it's gonna happen, and that we need to master something even more to do it, to some of our friends. Best if the way they will not know that it's being done to them, so that they're gonna be amazed. So I don't know how many ethical rules I have broken during the time of my childhood doing those things to my friends. One of the most crazy thing was actually when I read the first time the book called Psychobiology of Mind-Body Healing, and the Dr. Rossi. I actually received that book from a friend when I was 14, and I didn't understand almost anything from over there, but I read it. And there was this idea somewhere in there of the transduction of information, right? So I didn't understand the whole thing too much, but I understand it in such a way that the information can transduce from one channel to the other, from one level to the other, that generally it can switch. So I was like, I wonder if you could induce someone to see something without any visual stimulus or any visual suggestion, for example, right? If you could, so the idea was we put a friend of mine, in a deep trance, and I said to him only one thing, that in a moment or two, he's gonna find out that he is somewhere and he's gonna see something. And then I played in a sound system a dark ambient music, very dark and murky music, like from designed specifically to evoke anxiety and things like that. And the guy went into a panic attack, and he was so frightened that we were not able to wake him up from this state for like half an hour or something, because he was unresponsive. He fell from the chair. And we did that, I think, when I was 15, right?
I was going to say, and how many times did you do that?
And and it took another 3 hours to calm him down when he went from the trance. He had to wear an additional jacket because he was shaking from what he actually saw under influence of this music, is that he was somewhere in the field that was in the middle of the forest during the night in the winter, and that there was some evil thing in the forest surrounding him from all around and was trying to chase him or do something to him. And he didn't know what that is, but he knew that it was pure evil, right? So that's what we were doing, playing with hypnosis when I was 15 or 16 years of age. And then when I was 16, came across some NLP techniques and stuff like that. So we were experimenting if we can do something in hypnosis. Someone had some problem, like one of my friends, we were doing things to them, using some simple techniques to check if something actually works or does something to you. But saying all those crazy things, that was when I was a child, right? And then when I started to become when I went to my to do my master's in psychology, I actually did that to be able to train myself more into hypnosis and strategic therapy. So I knew most of the people go to psychological studies and then think what they want to do. I knew what I want to do, so I went to those studies because I needed them to actually go to US and do all those seminars that I wanted to, to take part in. So, being at the second or third year of my 5-year master degree program, I've heard at the ethics course that you're not supposed to work with people doing any form of therapy just after you finish your master's, because you need to undergo additional formal training, get some experience in clinical setting and work under supervision and everything. And I was like sitting there and I was like, whoa, good that I started when I was 16 or 15, doing clinical work. And obviously I did all that, I did the formal training and everything. So there are some of my friends that experienced deep trance phenomena with me, and it was mostly playful, and they have those memories from childhood. But now, when I work, and I work a lot using hypnosis, I have a very strong boundaries. I would never do it to a friend or especially to anyone from my family, because I keep my boundaries, because if you in the families, it works like this: you do it once to someone and suddenly there's like 20 people from your family that want to undergo a therapy for free and in your free time and so on. And in my case, I work a lot with people, work a lot with clients, and I love it, and I love doing hypnosis. But when I'm with my friends, I want to be with a friend, not with a client. And I want to have the opportunity to drink with someone a beer and just talk about, some simple things and not to discuss their problems. I mean, I can be a friend and discuss with someone some of their problems, but I don't want to, go there and find solutions to them. I want to be, to some people, just someone who's going to say, okay, I'm there, I'm listening, but I will not I will not do therapy with you, because that's something else. You need someone else, someone that's going to be, that will have different relationship with you than I have. And there were some people when I was doing psychotherapy, when I started, or were somewhere before I said to all my friends that were trying to go into my office, but there were some people that thought that it would be better to come to me because I already know them, right?
Mhm.
But then I said to them that this is a different relationship, and it doesn't work, somehow it just doesn't work. If you go to someone you don't know and you're just a client and he's just a therapist, then that's the only purpose of your relationship, and you can focus on that. When you are friends, then that's it. That doesn't work. So the same reason why I will never drink a beer with a client, for the same reason I would never do a therapy on a friend or a family member. But that's how I work. So I did those kinds of things, utilized hypnosis on friends, but mostly for the purpose of having fun, and sometimes it was crazy, but when we were children, right? But since
Right.
I was taught why it's important to keep those boundaries, and now I work, and it's really cool to have them, because with friends I'm just friend. I'm not at work anymore, So it's also healthy for me. Then I keep those boundaries because they help me to just be.
So there's a little bit of a margin if you're doing a teaching demonstration. You're teaching in a workshop, a group of people, someone that a colleague, a friend. I've always wanted to have a positive hallucination. Can you use me as your demonstration
Right.
subject? How do you handle that?
Well, mostly on seminars, that's actually a funny thing, because on seminars, I'm working with the students and they are becoming the hypnotic subjects. And most of the times what I do is I test them. I do those kinds of, stage hypnosis, hypnotizability tests, when you put one hand like this, one hand like this, and then they go like that when you imagine that there's book in one hand and something else, balloon in the other. And then I always choose the person who gets the worst score, because I want to show people that you can actually do those things to the people that people would reject, that it's not difficult to, demonstrate hypnotic phenomena on someone that, like, goes into hypnosis when you ask them if they want to do a demonstration, right? But I want to show people, I also want to show people that you can do it with someone that, it's not as easy. So I generally do it on students or, the attendees of the course. And I still don't use my friends.
Well,
And
unless
one more thing.
your friend is a colleague, unless your friend is a student.
That's true. That's true. But then this is only a demonstration. It's not a full therapy, It's like
Exactly.
it's something else.
So one of the things, what the thing that Kathryn mentioned is that if, we were allowed to practice on our friends or whatever, that she's right, that I would have everybody and their brother and their friends would be coming to me. I want you to put me under hypnosis. And to some degree, they did that anyway. Oh, your dad's a psychiatrist. That means he can read minds. He knows how to talk. Is he? I want this on me. So, for some degree, it happened anyway, even though there was that strong boundary.
Well, what's interesting about, because my experience is so different than both of yours, and that Ernie would, if someone that he loved had a need, it was not like a therapy. It wasn't anything that was ongoing, but it was just like in the moment of that there was this need to be resolved. And you made mention of, like, with my niece and my family, they're very, very respectful. They don't ask me to do these things. That I know my brother, who was going to go in for he was going to need to go in for a surgery if he could have, but what if he could avoid the surgery? And so Ernie and I did, I think, 2 sessions with him, and then he was fine after that. And so for him, there would have been no one else in the world that could have helped him in the way that we did. And he still remembers. And what's interesting is he remembers it as it happened on the inside of him. And so he ascribes things that were said, etc., that we didn't, but that were really beautiful. So it's really a true hypnosis. And another example is my niece, is in the military and, is an officer. And there was one of her soldiers, they were concerned for him. And so, 2 of the officers went to his house, to make sure that he was okay. And then they heard this gunshot and he had suicided himself. And they discovered later that for 2 years he'd been writing about doing this. And so so this was not a fast decision. And so she telephoned me and she said, I don't want to impose on you, but, I had this situation happen today. And so I was on the phone with her. I timed it, was for exactly 20 minutes. And I said to her that, that I said, well, do you want simple grief or do you want complicated grief? And she said, well, I want, Yanni, Kathryn, I want simple grief. I said, okay, he died. Not how he died, where he died, when he died, who was left, who survived him. And she became really quiet for, I don't know, it was about 3 minutes. And then she spoke. So obviously she was in trance during that, it was not formal. And she said, I'm really going to miss him. And after that, she said, I'm okay. And she went into work the next day. And so all the other soldiers that were associated with this man, she brought that in, and they missed him, but they were all okay. So it was like a crisis situation. And so respectfully, she asked me. And there's a couple of other small times she's asked me, but it's never been a take care of me situation. And I've had this, I don't know, probably, at the most, I've done it 12 times with friends, at the most 12 times. And in each time, it was of a situation that they were perplexed about, and they just needed a little bit of time to tune in. And they needed to they weren't able to do it themselves. They needed it to be a little bit more formal. They needed it to actually be a hypnosis. And so it's like on a case-by-case basis. And like I say, I mean, gosh, it doesn't even come up once a year. So it's not like I'm inundated with this sort of thing. But if at the moment, if it's someone that I love and care about, that I'll take that time. I have 2 friends right now that were diagnosed with cancer. And I immediately went to them, and one of them, we did do a hypnosis to be able to tolerate the chemotherapy. And so in something like that, to be able to make it possible for him to perhaps, cure his cancer. And so it's really situational in which I use it. And I'm honored each time to be clear with you, is that, when I see someone that I really love, and then all of a sudden they're moving in a place towards health with the inside of themselves, it's a privilege. But as I say, it's well, I guess this year it's been 3 times that I've done it, but there's years go by and that's not the case.
And have you ever had, actually both of you, have you ever had a example? Since I'm not working with any friends and family members, that question actually doesn't apply to me. But did you ever had an example that you were working with a friend or a family member, and they actually were trying to kind of pull it further? And if that and if not, what would you do if that happened? I mean, do you have any kind of, first of all, how would you, recognize that it happens? What would have to happen? I mean, is it like 1-2 sessions is okay, but like 10 is more than enough? I mean, I'm thinking about the criteria. And also, if that happens, if you felt, I would use the word, if you felt abused to some degree by someone that is using your generosity too much, what's your way of keeping the boundaries in those situations with close ones, right? That's my question.
Well, I think as psychotherapists, we're faced with that all of the time, that we get clients, even, paid customers that come in, that that are seeking something beyond what we are really offering. As you know, the three of us are interested in guiding someone in the direction of health, of being more independent, being more productive, being happier. So somebody comes to us, that's what we're seeking. And every now and then, as a therapist, somebody just gets comfortable with settling in, and I just want to be passive and you hypnotize me, and that'll feel good. And it devolves to an entertainment, comfort zone. And so, we have to, I certainly know that I have had to lay out the boundaries that we've made positive progress, and it's kind of productive to keep on to settle into a state where it devolves. I mean, that's just inappropriate. But one of the things that I want to reflect back on with Kathryn said that 2 or 3 times this year, you've had opportunities when friends have had health things. And likewise with me, since I have a nursing background, in addition to the hypnosis background, I feel like I'm particularly well positioned to offer pre-op, if not sessions. And if a friend of mine has, an unexpected surgery or even a planned surgery or some big, intervention coming up, I should not offer them, my skills just because they're my friends. That doesn't really make sense to me. So what I have made a decision to do is, if I learn that some friend of mine is scheduled for surgery, I make them an audio tape. And I say, I've made you a hypnotic pre-op audio tape. I'm sending it to you. You can listen to it or not listen to it. I don't care what you do. But I felt like I wanted to offer this to you, and, here it is.
Well, and I mean, that's a really, good way. And I'm remembering the time that you did hypnosis with me one time, and it was great, and I think I've done the same for you, Roxy, if I'm remembering correctly, that it's like a spontaneous thing. But if I'm doing something because I'm so moved, for family or close friends, that if I'm asked again, I have the opportunity to say, well, no, that was just a one-shot deal. Is where then I set the boundaries that way, and to say, when you need more than this, we need to find you a therapist. Exactly. And so it's done with great kindness, but I am not the therapist for my family member. I'm not the therapist for my friend. That, the occasional getting somebody over the hump, as they say, that's a different kind of story. Or if there's an urgent matter with it, that's a different story. But ongoing, no, that's not appropriate. It's just not appropriate. And so and that's just as I'm saying it to you here, that's how I say it, is that as Jan, you didn't use the word dual relationship, but ethically, one has to be very clear and to not have a dual relationship. And so, occasionally you might share a skill with a friend, just like you might bake them a batch of cookies, but it's not an ongoing thing, and it is done exactly the way that your father did with you, is that there's an agreement, it's like a formal agreement sort of thing of, let me help you through this time. sort of thing. But I would not do ongoing things, except for, with my brother, we did 2 sessions close to one another, because that's what he needed. And that was 10 years ago, and he's never needed anything since. So, and Ernie and I both made that decision together about what we were going to do. So it wasn't just me. And ultimately, respect, and that respect for yourself as a therapist, respect for your friend or your family member, and that it's always turned out positively for me. That's the only thing that I can say, is that, and like for you, Roxy, to be able to create a tape and say, I made you a tape, that was something that you felt good about doing. It was what you wanted to do. It was in your heart to do. It was your intuition to do. And so you were pure you to do it.
Yeah. In the same way, the audio tape is like the cookies. I baked you cookies. You can eat them or not eat them. You don't have to report back to me what you ate.
Mhm.
I was also thinking about one more thing, since you mentioned your background in nursing and the other point of view on the matter. I suddenly came up to me that maybe we should actually divide between hypnosis itself and psychotherapy. These are 2 different things. You can use hypnosis for psychotherapy, but we are also talking here about other things, like, for example, helping someone to get through a chemo. I don't think it's a psychotherapeutic thing. You are using hypnosis to create other skills. And helping someone with a headache, for example, or I don't know, preparing someone for the delivery, right? This is not psychotherapy. Putting someone under anesthesia to have a dental surgery or something, that's not psychotherapy. So I think that although I never used hypnosis on close ones or friends, started to think now that as a skill, I think it may be used to a degree on friends, as in my head, as far as it's not a psychotherapeutic thing, but more like it's a tool or a environment to help someone to elicit their own skills to kind of deal with some situation, but other realms, and probably also other areas of life, like dental surgery or pain management, maybe have their own regulations, or nursing, and then that's something different.
I think it's a very good observation, Jan, is that it's one I hadn't really thought about before. And and so it's something for all of us to think about. Well, as I'm looking at the world of how long we've been doing this podcast, this might be our longest one yet.
Oh,
I don't think so, but it's
It's
pretty
close.
but we're going there. We're getting there.
Yeah, I think that we have to.
Okay, so do you have anything to any final thoughts, or?
I do have one, going back to Milton Erickson and his free use of his children to explore, to discover, and sisters and other family members to explore, to discover, to teach, and all of those things. I will say that Martin Orne, who was a colleague of that, younger, but he was a colleague. He was a researcher in hypnosis, very well known.
Yeah.
That Martin Orne, I remember him sitting on the sofa at our house, brutally, verbally attacking my father. This is wrong. Do not do hypnosis on your children. This is not a good thing to do. And he took a very, very powerful, strong stand against my father. And the outcome, so I remember it as being a very, interesting, conversation, animated, and Dad stubbornly, I am working in their best interest. He was defending that he had our best interest in mind. But I've thought about that conversation years later, and it really makes me wonder whether Dr. Orn influenced my dad to be a little bit more formal and more structured than he otherwise would have been. And so I think in my own heart, I thank you, Dr. Orn, for making it really clear that there is two ways of looking at this. And Orn felt every bit as strongly that he was in the right as my dad did.
So I have to tell you a Martin Orn story.
Okay.
So I didn't know like who he was, and it was my first trip to Europe with Ernest, and there was a conference, but only the people invited were the ones speaking, and it was at the Salterpierre. And so they had fantastic parties at the end of each day. And there was one, it was a beautiful dinner. And then Ernie and I were getting a taxi to go back to the hotel. And here is Martin Orn, and he's standing, and it's raining and it's cold. It's November. And I said, "Oh, join us in the taxi." And I literally melted that man's heart, because he was like so uncomfortable, but he got in, right? Because it's raining and it's cold. And we just had a little conversation. And then we were both at the same hotel. And then he walked up the stairs, and Ernie said, "He hates Erickson." And here I am, just this friendly, sweet person. So I accidentally melted his heart towards, his feelings for Ernie, his feelings for Erickson. And the next day when I saw him, he had a big smile on his face. And so he was quite, adamant about how he thought that the ways that things should be. And so I'm glad to know that you appreciate that he has both sides. And then I melted his heart.
Yeah, and it also goes to show that you can learn, even when you are diametrically opposed to somebody's point of view, you can still learn from them.
Absolutely.
Exactly. Do you have any final thoughts?
No, it's like, let's appreciate the diversity, and that this particular podcast, I think we always give ideas for people to think about, but this really gives a set of ideas of, would you work with family or friends, in limited times? How would you do that? How would you set the comfort zone, not just the boundaries, but, do you have to be really comfortable with it? And that I think I want to emphasize, this is an occasional thing, it's upon occasion, for occasions that make sense. But I hope we have given people some new things to think about.
Okay. So thank you both very much for this incredible podcast and all these opportunities, and see you next time.
Okay.
Bye.
This was another episode of our Experiencing Consciousness podcast. Thank you for being with us.
Thank you, Jan. You're the best. Be well, be happy, celebrate life.